Good day everyone, so today I'm going to show you the procedures on how to administer the topical medication. First is you need to gather all the equipment such as the medication tray, the kidney basin, the gauze pad, the gloves, and the cotton tip applicator. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness the medication for the patient. Perform hand hygiene. Prepare medications for one patient at a time. Read the medication administration record and select the proper medication from patient's medication drawer or unit stock. Compare the label with the medication administration record or the MAR. Check expiration dates and perform calculations if necessary. When all the medication for one have been prepared, recheck the label with the MAR before taking them to the patient and return the medication stock to the patient's drawer. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medications at the correct time. Identify the patient. Compare information with the medication administration record. Check the name on the patient's identification band. If the patient cannot identify him or herself, verify patient's identification to the significant others. Complete necessary assessments before administering medication. Check allergy bracelet or ask the patient about allergies. Explain the purpose and the action of each medication to the patient. Perform hand hygiene and put on gloves. Use non-sterile gloves unless the skin is broken, then apply sterile gloves. Wash, rinse, and dry the affected area with water and clean gauze. If skin is dry and flaky, apply topical medication while skin is still damp. Change gloves and perform hygiene in between. Use sterile gloves for open skin lesions. Place required amount of medication using a cotton tip applicator. Note the cotton tip applicator is sterile and it is for single use only. Let the patient know that initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. Observe signs of irritation or redness. Perform hand hygiene. After doing the procedure, document it in the patient's chart.